Nito ko tetutietab tililindo ole inyorune logoiwek tugul chetinyegei ak kanyoiset cheboto kanetisiosiek chetoretin eng teretab mionwogik.
Thank you so much for making time to have this discussion. The issue of TB is something that we've been talking about often. And for those who are watching at home, they know Chesang has been spearheading this conversation, and we've had a few doctors and even TB champions speaking about the issue of TB. But one thing that kept coming up was the issue of extrapulmonary TB. We thought this is an interesting conversation whereby when we talk about TB, people think about the lungs, and how it spreads through that. So it's really interesting to have a conversation with you to understand more. So please, let's start with you introducing yourself. Tell us where you are and what you do.
English is challenging.
Okay, so we thought it would be better if we can speak English for now, but then at the end of it all, you'll have a moment to have a one-on-one with the audience. Yeah.
So thank you. My name is Duncun Barkebo. I am a clinical officer, but currently working at the Center for Health Solutions Kenya in Meru County, supporting the Upper Eastern region, where we support the National TB program to ensure that all the TB program is done well, and that patients who have TB are treated according to the guidelines, and also eliminating TB in the country.
Mm-hmm.
Yeah.
When you talk about Center for Health Solutions, what do you mean? Is it a hospital?
Yes, so thank you very much. Center for Health Solutions is a non-governmental organization, which is a local indigenous organization led by Kenyans, formed by Kenyans and led by Kenyans. And we have a partner in the national government through donor support from USAID to support the Kenyan government and the people of Kenya in general to address tuberculosis, with the sole aim of reducing the burden of TB in Kenya. But we have been around for the last 10 years. So we've been able to understand the local context and issues around tuberculosis in Kenya and even beyond. Thank you very much.
Okay, but do you mind me asking what you do exactly where you are?
Thank you. So what I do exactly where I am is to do different aspects. One, first of all, I'm a clinical provider with patients. So I consult, I see patients in the clinics, but mainly capacity building other clinicians to ensure that they do the right thing in tuberculosis, because I have specialization in tuberculosis and lung conditions. The second thing I do is to offer consistent mentorship, and this is a broad aspect of mentoring both the clinicians serving the patient, but also the leadership of the county in terms of ensuring that they prioritize tuberculosis as an agenda, as more of an advocacy role, to ensure that I mentor them to make sure that they put resources for TB, they prioritize TB in their work plans, and they ensure that as in the county level, TB is prioritized and patients who have TB are prioritized to get the best treatment and the quality of care they deserve.
Yeah. We're going to get later on why it's important to have TB as an agenda in the country, seeing as TB is an old disease, but we're having this conversation today. But it's good that you specialize on TB, because now you can explain to us, what do you mean by extrapulmonary TB?
So thank you, Chemtai. I think the first, before even I explain what is extrapulmonary TB, it's important to bring into context the TB itself, because we know that TB has been around for many years, more than 120 years, and even beyond. It's only that in 1882 it was defined by Robert Koch. But it has now been shown that TB is a disease which is caused by an infectious bacteria or germs, which can actually affect the lungs, but also can affect any part of the body. So primarily, TB starts by infecting the lungs. But in in one way or another, the bacteria can actually take advantage of the immunity of the person to move outside the lungs to go to other places. And it can affect any part of the body, except the air, the nails, and the outer part of the teeth, which are basically composed of dead cells. So TB in the lungs is primarily the predominant one, but we also have this extrapulmonary TB, what we call TB, which is outside the lung tissue. And this occurs because the bacteria itself has been controlled by the immunity, but some of the immunity has failed. And therefore, they move out through the blood vessels, through there are those elements we call the lymph nodes, which are basically your immune system mechanisms, to go to areas. For example, it can go to the brain, it can go to the bones, it can go to the stomach, it can go anywhere in the other parts of the body. That is what we call now extrapulmonary tuberculosis.
Okay. So if someone hears pulmonary TB, that is one in the lung. Anything outside the lung is extrapulmonary TB.
Exactly. Very true. Anything outside lung is actually extrapulmonary tuberculosis. That's
really interesting. Today we wanted to focus on the issue of urogenital TB, and we tried to, me and the team here at Tililindo, we tried to look at the issue of genital tract TB, and urogenital stood out. So I don't know if you can explain that to us, because I have follow-up questions regarding what do we mean by a disease in the urine or something like that.
So this is usually a very unique condition. First of all, we need to appreciate that. The urogenital TB means that it is tuberculosis which has gone to the reproductive organs and also the urinary organs. And you remember the urinary organs, we have the kidneys, we have the ureters, and even the ureters which sheds out the urine from the body. In the genital system, we have, for example, in women, we have the fallopian tubes, we have the ovaries, we have the uterus, the vagina, and the rest. But in men, we have the prostate, we have the testicles, we have the other parts. And so TB actually can move all the way to those areas of the reproductive system and the urinary system. So when that happens, we call it a urogenital tuberculosis. And just to put into context, is that it is actually been seen that it's more common in women than men, the urogenital tuberculosis. But there are many reasons that this can occur, but primarily it has been shown that the blood system feeding the urogenital system for women is much higher because of the fact that they are supposed to have babies and know that the uterus is a major organ for the reproductive system. But in generally, we'll say that because extrapulmonary TB is something which it's usually very hard to diagnose, and the patients go long before getting diagnosed. And in most cases, even from my experience, this urogenital TB in women has been diagnosed sometimes even in theater, where the surgeons actually have operated on somebody who has had things like fibroids, or basically somebody who says they have blocked the tubes, they are not able to get babies. And when the surgeon opens, they realize the material there is typical of TB. They send to the lab and it confirms TB of the fallopian tubes. So this is a reality. It's although rare, but it is actually existing. Yeah.
It's really interesting. You mentioned the delay in diagnosis, because there's a conversation we need to have on that. But it's also important when you spoke about it being able to affect, although it's predominantly affecting women, it can affect men. When you mentioned something about fallopian tube in women, because what we were discussing is when you try to learn more about different aspects of TB in the genitals, there's issue like cervix TB, urogenital TB, and that's what we were asking. Is it one and the same? But we know men don't have cervix, or do they?
Yeah, of course, men don't have cervix. So cervix is, remember, it's just part of the genital system of a woman. It is basically the opening to the uterus.
Yeah, so
that can actually, that can actually happen to actually cause TB can actually affect the cervix itself.
Okay, so
but also can go to the tubes and the other parts of the reproductive system. Yeah.
Okay, I'm so sorry to cut you. That's what we were thinking. Urogenital TB is a disease on its own, and cervix TB is another kind of TB, extrapulmonary TB, right? It's not one and the same.
No, it's actually the urogenital TB is a bigger name to the TB of the reproductive system, and so cervix of it's just part of the urogenital TB.
Okay, good. Now we're learning. Is it a rampant kind of TB, the urogenital TB?
It's not a rampant thing. It's urogenital TB is quite rare. Looking at some studies which have been shown, I just looked at some of them. They actually note that it's quite rare. It's around 2% of the extrapulmonary TB will actually be urogenital TB. But the interesting thing is that women are more affected than men. Just to put into context, tuberculosis basically affects men in general, the genital tuberculosis. For example, globally, 52% of the people who have TB are actually men. In Kenya, 65% are actually men. Only 35% of people who have TB are women. And with that, even, of course, we know there are many reasons why that happens. Women are more proactive in their health. When they get sick, they go to hospitals. And generally, even women find themselves in hospitals most of the time because they have to take children to the clinic. They have to go for antenatal care when they are pregnant. They have to take somebody to the hospital when they are sick at home. So their health-seeking behavior is quite good. And so TB, because it's a chronic condition, tends to be less in women. But now when it comes to extrapulmonary TB, it is more, the urogenital TB is more common in the women than in the men. One, because the major contribution is the fact that it is the delayed diagnosis. The most of the time when somebody presents to the hospital with genital issues, the reproductive system issues, the most common things are thought by the doctors. And so it is normal to think it is maybe a problem with the cervix, it's a problem, inflammation in the tubes and all that. And therefore, people really don't think about tuberculosis at that point in time. And so this is a good platform to bring that aspect that, yes, these genital issues which patients can present, especially women, doctors should actually start thinking about tuberculosis in that sense.